Dr. Danyo, it's so nice to see you again. How are you?
Clark, great seeing you as always.
Our topic today, common misconceptions about hair restoration. You're probably hearing everything under the sun.
Yep.
Right? And I would love to just chat for a few minutes about some of those misconceptions, and maybe we can even look at this as like, hey, what are the top 3 misconceptions that people get wrong about hair transplantation? What's the first thing that comes to your mind?
Well, I think the first thing is that it's going to look fake.
Why do you think people have that impression?
Back in the 70s and 80s, there was a procedure called plug surgery. In fact, I have a lot of people that I do consults on, and they're like, how many plugs do you think I need? And I'm always like, they're called grafts now. But plugs were full-thickness skin grafts. They would literally take like a punch biopsy that was about 5 millimeters and literally just punch out hair-bearing scalp and then take a punch out of skin and then put that punch in and then sew it into the skin. So...
Every part of that just makes me want to cringe. It sounds like a miserable experience.
Well, back in the day, I mean, that was what was available. But believe it or not, I mean, this is crazy. When do you think the first hair transplant was done?
I mean, maybe it's a trick question. I mean, my mind, I don't know, thinks back to, 70s or so. I mean, that's so silly. It probably goes way back, right?
It was actually 181 years ago. So, yeah. It was done by a German medical student, and he convinced his attending physician to come on board with him, and they wrote a couple papers, and then it literally kind of got lost. And then kind of at the turn of the century, like 1800s to 1900s, they started doing some scalp reductions and kind of moving some hair in pretty much 1939, I think it was. There was 2 physicians in Japan that actually started doing almost what we know of as FUE, which is follicular unit excision. They were taking small grafts from the back of the head and first putting it in hair that was traumatized either with burn or trauma. And then they did hundreds of patients actually with male pattern baldness. And the problem was they reported their findings only in Japanese journals, and it got lost during World War II. Things evolved quickly in the 1950s. There is kind of a surge to start doing scalp reductions, which were pretty brutal. Literally, they'd take out skin and just kind of sew the edges together, and even some flaps where they'd flap hair over. And then the plugs became kind of the main standard treatment for almost 30 years. It really wasn't until strip surgery came out kind of in the mid-'80s where they were able to take a strip out from the back of the head and kind of section those into individual follicles that really hair restoration, as we know, modern hair restoration, where we're taking at times one actual follicle at a time. And that's what we see today. I mean, we can make really natural results and not have a pluggy look. But the key is really this is something that you can't take lightly. I do a lot of consults, Clark, and people always ask, why are you the best, or why shouldn't I go to a place that might be a little bit more inexpensive? And I tell them that it is very hard to get a natural look. And I've been through a lot of consults and seeing patients that are coming in for repair surgery that just have had really bad results. I mean, case in point, this week we saw somebody who had like a radial placement of hair. So here on the sides, we're going this way on the left and then this way on the right. And, he said this is like unmanageable to style. But that's just a flaw in decision-making and a flaw in creating a natural look. So I think in good hands, and it really takes somebody with technical know-how who's involved in the procedure who can really pull this off. Because if you don't find that person, maybe you're looking for like the cheapest price, it can be a disaster, and it's going to cost more money in the long run to fix it.
It makes a lot of sense. Misconception, it looks fake. And what I'm hearing from you is if you do it the right way, the art of FUE, which is your specialty, that is a way to overcome that misconception. So, boom, checkbox number 1. What else? What do you think? I know you hear a lot, but if you were to think of another common misconception or something that people get wrong when it comes to hair restoration, what is that?
I think the second one is going to be a major disruption in somebody's life. Most places actually do a shave procedure for FUE. A lot of physicians still do the strip, and you can get by without shaving the head, but as things have evolved, people are just not interested in having linear scars. So FUE is becoming really kind of the mainstay, and that's follicular unit excision, where we take individual follicles from the back of the head and then place them into the balding area. Now we have Shave-Less FUE, and I've actually been doing Shave-Less FUE since 2013. I was one of the first in the country to do it. We do it about 70% of the time because concealment is key. Most of our patients are really active socially and at work, and the thought of getting their head shaved, either whether it's the back of their head or their entire head shaved for a procedure, just doesn't cut it.
Yeah, it's such a intimate, very important, sensitive topic. So
yeah, I mean, we talked about this before, the art of concealment, and there's so many things that go into a procedure. You have to use the right medications, the right amount, do nerve blocks to minimize the amount of swelling that's created by adding way too much medication, which is very common. So if you do like a shaveless procedure and then your face ends up getting swollen, that's not a good thing. So we really work on minimizing the chance, and usually it's less than 10%. We don't get like massive swelling. It's not like people walk out of here with bandages, active bleeding and things like that. People leave, especially after a shaveless procedure. Once we clean them and blow dry their hair, there's no active bleeding. The grafts look very clean. The hair around it is clean. And I would say it's pretty uniform that people are shocked. So the whole concealment thing and kind of getting back into work in society, I mean, we've got this thing pretty much licked.
Well, you being a doctor, an MD, with your background before this, I mean, hey, being Shave-Less FUE since 2013. Before this, you had your practice around, I think it was pain management, right?
It was physical medicine rehab. Yeah, and more interventional pain management. I did a lot of epidural injections and nerve blocks. I got certified in acupuncture as well. We had kind of a cool practice because we had a really large wellness center with personal training and physical therapy and nutrition and massage. I mean, it's pretty awesome.
I always learn something new. I did not know you had that aspect of it. So the reason I mentioned that is because there's a real science, of course, to using what you need. You don't want to use too much of it or too less of it. That's what contributes to someone overswelling or having it's all about concealment.
Well, when I was in the kind of the interventional pain management days, and I don't know if I've told the story before, but I had a neurosurgeon call me one day because I did things differently. I wanted to make a situation where we had a certified center to do these injections, but I didn't want to have it at such a high level where we're billing for that service, where we had to do anesthesia, just kind of this big old rigmarole. I was able to do injections quickly and relatively pain-free, where people could drive in themselves, go back to work the same day. So this neurosurgeon called me and said, "What the heck are you doing with my patients?" And I thought he was mad. He said, "No." I'm like, I send people over there and everybody's like, "Yeah, it was great." So, and cool. That's without doing much sedation at all. And so I've had really just a keen sense of the needs for people. It goes beyond the actual procedure. I really strive to get people back to work, back to social activities ASAP.
kind of like magic. You go in, you can make a weekend trip out of it, right?
Yeah. But it takes a lot of hard work, a lot of diligence, and just kind of trial and error. I mean, I've been doing this now for a long time, and what I am doing now, in a lot of respects, is even different than 6 months ago because we're constantly refining our technique and making it better.
That's really cool. That's how you operate. I know you're always trying to find ways to get better and better. So, is there anything else? What do you think is another misconception that people get wrong?
The third biggest thing is it's going to be painful. And
it sounds painful. Like on the surface, if you don't know anything about this, and each individual, like you almost would imagine like that doesn't feel good, but you have a way to make it pain free.
Yeah. Well, first I have to preface that on the web there are kind of stories of people having lots of pain and just a bad experience during their hair transplant, and that's not the case here. And I really don't know what goes on in other offices. I do know, in fact, our association sent an email today with new guidelines on really not allowing non-physicians or non-licensed individuals, such as physician's assistants, nurse practitioners, doing hair transplant.
That's big.
And the problem is in this market, especially with price being a main driving factor, there are many offices that use non-licensed technicians who actually are administering medicine and doing these procedures, but creating a lot of pain and a lot of undue risk. So I say that because the stuff on the web is not what we provide for our patients. First, because I come from a pain management background, I've got a great knowledge of medications, and I literally have done millions and millions of injections between all the spinal injections and trigger points and joint injections and acupuncture, and not to mention, we've talked about this before, I've done myself extracted in place over 5 million grafts. So when you inject somebody, the touch and the way of injecting that medication is so important. We could use the same needle, and if somebody is inexperienced in how to inject and where and what layers are involved, it can be very painful. But if you do it right, no, it's actually painless. So our patients are very surprised. We generally have patients that are pretty anxious when they come in. But once we get through the first round of blocks, which are really easy, especially to do the donor area, everyone just kind of settles back and relaxes, and we have a great day. And then post-operative pain, I haven't written a pain medication in over 5 years, and so it's not something like, you go home with some hydrocodone or Ultram,
right? Like another medical procedure that's common. That's common practice, but not here.
Yeah, Tylenol and Motrin is fine, and I would say, as far as if you're going to get some pain postoperatively, it's not going to be where we place the grafts. It's usually kind of behind the ear, but that's very treatable and very minimal. It's more like soreness, not actual pain. So I think the third misconception of pain in skilled hands, the answer is no, it's not painful.
Great. Quick recap. Number one is, hey, one misconception, it might look fake. Number two, you can't conceal it. And number three, it's painful. And I love how simply and straightforward you made that, like, hey, actually, if you have the right team, but it's you and your trained team,
yes,
does all of this together, then, hey, this can actually be a great path for someone. So that answers all my questions.
I think the last thing, to do this right, you brought up the team. It is literally an orchestra for us to extract in place. It creates efficiency in the procedure, which maximizes results and limits the time so that we don't have to reapply medications to numb. So we're working within that time clock. And it limits the procedure time so that you're not getting back pain and neck pain and discomfort. So, again, we've got this thing licked.
Dr. Danyo, as always, thanks for taking a little bit of time to share. I really appreciate it.
Thank you, Clark.
Hey, thanks so much for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review this show wherever you listen to your favorite podcasts.